So Eric is the host of a mycotoxin summit coming up. So I'm just excited to share it. It's very pertinent to many people in our community. So yeah, I'm excited to talk to him. He's a new friend in the mold space for me. I had never heard of him. I was like, what is this other mold summit? This is awesome. And you have a lot of guests actually that I didn't have. So we're kind of just traveling in different circles, and it's awesome. So we can learn from each other.
Yes.
Okay. So let me read his bio. It's really interesting, and we're gonna kind of leap from there. One sec. Dr. Eric Gordon, MD, president of Gordon Medical Research Center, is the founder and owner of Gordon Medical Associates, a private medical practice in the San Francisco Bay Area specializing in complex chronic illness. In addition to clinical practice of 40 plus years, Dr. Gordon is engaged in clinical research. Between 2007 to 2009, he created a series of medical symposia bringing together leading international medical researchers and cutting edge clinicians focusing on ME, CFS, Lyme disease, autoimmune diseases, and autism. The collaboration of innovative medical practice with the University Research Center has been his lifelong dream. Combining forces with Dr. Robert Navio and his research into metabolomics, mitochondrial function, and chronic inflammatory disease is now bringing this dream to life. In 2016, Dr. Gordon was co-authored with Dr. Navio on a groundbreaking study, Metabolic Features of Chronic Fatigue Syndrome. That sounds really interesting. I'm going to have to read that one. And most importantly, I'm excited to have him on talking about the connections he's seen between mycotoxins and some of these diseases over the years. So just my background to the question is, I guess to me, I've read a little bit about the golden age of mycotoxin research, which I don't know was more with animals or just general research. And then with Shoemaker, Dr. Shoemaker did a lot of work around mycotoxins and other environmental illnesses. But yeah, there's a lot of missing pieces to me on how this all developed. And I'm super excited because I think you can fill them in. So you've been working in these complex chronic illnesses for a number of years. When did this kind of mystery or suggestion that there could be maybe something from the home or something from mold first enter the conversation for you, Dr. Gordon?
Well, first of all, I want to thank you and just mention something. Always says Dr. Navio and it's not really. I supplied the patients. He supplied the brains. I mean, okay. I when we
I'm still giving you 50% credit.
Okay, okay. I just like that for the public there. I mean, if ever Dr. Navio is kind of I just think he's so creatively smart and his
Mm,
way of looking at medicine, and we'll rope that in later because it's the way he looks at medicine is if we all looked at it that way, this conversation of when did we first start thinking about mold wouldn't have taken so long to become to the forefront. Okay,
mm,
because if when you look at things from first principles and when you really think from the beginning of stuff, which is something Dr. Navio does very well, the world gets, you know, we still don't get the details, but we get the outlines of the problem a lot clearer and a lot sooner, because mold has been an issue for as long as I started doing doing medicine in like 1980, but I was interested in what was called alternative medicine in those days in the 70s. And there was, I think Dr. Crook wrote a book, The Candida Connection or the Yeast Connection, okay, about Candida. I mean, like that Candida overgrowth was talked about back then. It was a big deal. And somehow it was always part of our world. We were always treating with antifungals, natural and pharmaceutical. I mean, like from the beginning, it just was a sidelight. how to, so to speak, we didn't realize in the early days that we just thought in terms of the mycotoxins or the toxins that yeast that lived in our gut were producing. Okay. The amount that was contributed from the environment wasn't as clear. And I think part of the reason it wasn't as clear is because houses were built so much differently. We didn't have the tight housing thing just happened, I'm not talking about the housing market, but the closed in hyper insulated, houses is a product that started in the 70s with the oil crash. This is all old history.
No, I have heard about this. We had to make homes more energy efficient.
More
was
energy
the
efficient.
idea.
You go into houses that were built, from in the early 1900s till the 70s, single pane windows, no insulation unless you were in places that were really cold. In Northern California, lots of no insulation. The house I first bought up here, nothing, and so you had lots of air exchanges. So mold wasn't that much of a problem, but when you tighten up a house and make it so there's like no air exchange per hour, and you have a little bit of mold growing, you have a problem. It's so that's why I think mold was kind of the mycotoxin component took a long time to really come out into the public, into everybody's ideas. So, and the alternative, and then, you watch things. In the 80s, it was all parasites, and Epstein-Barr. Everything was, chronic. Everything was, either you had chronic viral infections and things we didn't understand. Because basically, the focus right now, so many people with poorly understood symptoms wind up in the mold community now. The brain fog, the strange feelings in your body, the various ways you hurt, that you go to the doctor and they look at you like, you're just kind of neurotic, because your basic blood work is normal. And so over the years, people with those complaints have wound up in what I call alternative medicine doctors. Now they're functional medicine doctors, and lots of naturopaths and chiropractors and acupuncturists, because that's what's changed. The naturopaths used to be like, very, very rare. And doctors who cared about anything other than your blood pressure or your blood sugar were very rare. And both those things have been changing in the last 20 years dramatically. So but also what's happened is that people who are presenting with illnesses that don't fit the conventional model are increasing. What I'm talking about that
yes.
are the people who are listening to this. Because, if you're very few healthy people are listening to what we're talking about, they just listen and move on, but it's
right. They're hungry for information. Yeah. I have to comment that when you say candida, parasites, Epstein-Barr, I'm like, I might be biased, but I feel like mold can be the root cause of even those, because it's weakening the immune system and breaking down the gut and all that.
Well, exactly. What's causing what is hard to say, but it's funny. It's our biases, because my bias is that I still believe that most of the people who have sensitivity to mycotoxins, because mycotoxins are ubiquitous, they're throughout the environment. Everybody's exposed to mycotoxins, and only some people have symptoms. And this is something Dr. Shoemaker thought of years ago, and again, it could be between my population, but almost everybody who has mycotoxin problems, there's something underneath that, because your immune system should deal with mycotoxins unless massively exposed. And even then, most people massively exposed, they might get sick, they leave the environment, they get better real fast. Okay. The people who stay sick, they get colonized, or they're just not able to mobilize the toxins. And so something's really wrong. And for me, that usually is my thought is that they've got some tick-borne disease that they had that you might not need to ever treat, because their body might have dealt with it. But when after you have a tick-borne disease, some people wind up with issues with some of their cytokines are out of balance. IL-10 is a big one that helps modulate the immune response, and then we get into more trouble with trying to deal with mycotoxins, trying to detox them
Mm.
and get them out of the system. But I'm sure, that would be an interesting question. You ask 10 practitioners, what do you think is the underlying issue? And I bet you will come up with probably 6 answers.
Yeah, we do have our biases. And I would say, even though I've interviewed a lot of people with Lyme,
Yeah.
it's still one that I personally haven't tested for, but I do suspect a bit. I'll just share a little story that I got a hyperbaric oxygen chamber, and I did not feel well in that thing. And I read that sometimes when you have Lyme, you are like detoxing and dumping in there. So it made me a little suspicious, but I did actually start to tolerate it better. I had to really slow down. So, just a little clue, but yeah, it's a great point.
Yeah, but anytime you've had a chronic illness, whether it's mycotoxin induced or layered induced, because I mean that we'll talk about that, because that's really one of my big things is that in my world, and it's so funny how it's like my world and you could be seeing different people, because I just have to make this segue just to understand. Back in the early 2000s when I had those meetings, I had a wealthy patient who was opening a new center and just gave me the gift of being able to hold these meetings. He just donated all the space and the money and paid people. It was just amazing. But I had Dr. Shoemaker was one of the guests, one of the, we had 5 meetings and he was there every one of them. And this, and at the time, Dr. Cheney, who nobody remembers anymore, but Dr. Paul Cheney was one of the fathers of chronic fatigue. He was one of the doctors at Incline Village. And he did a lot of work with patients with chronic fatigue. He unfortunately just passed away, I think, a year ago. But and he and Dr. Shoemaker really realized that they were seeing different patient subsets, because in his eyes, everybody had chronic fatigue. And Dr. Shoemaker, everybody had mold illness. This was back in 2007, 8, and the reality was there was some overlap. There were a few people they traded back and forth over the next few years, but most of the time, people tend to self-select. It's very interesting how but they all had chronic illness, fatigue, brain fog, pain, gut issues. I mean, these are the things. If you look at the list of symptoms, Bartonella, Lyme, Babesia, chronic viral things. I mean, they have different flavors that I think I can sniff out because I've been listening to people for so long. But really, if you just do it by patient lists, it can be anything, and that's what people have to realize is that looking at lists of symptoms and saying, I got that, hold that gently. You may, because I have great respect for people's intuition. Because I always say, you're on the inside, you got a deep feeling of what's happening. But also sometimes it's just, that's the only information you have. So and doing it by lists of symptoms, you got to be a little careful with. So anyway, I'm sorry, I digressed.
No, not at all. I think this is all really rich. And yeah, I've made that mistake too. And I've seen clients make it. I was having Epstein-Barr and I was having these swollen glands and I'm like, it's Epstein-Barr, it's Epstein-Barr. And then a friend sent me a Candida supplement that he developed. And lo and behold, what went away? My swollen glands. So yeah, it is, it could be something you don't think. And it is, frankly, it's just like a tangle, right? You could have 10 different things at once. So how do you know, where to go? I'd be curious when you mentioned something about the levels. I think there are different opinions about order of treatment. I have sort of my theories, but I'd love to hear more about yours.
Okay. Well, let me tell you two little pieces about
Okay.
this. These are things I said. We in my group we meet every week, and I said Dr. Nathan used to work with us until 2016. And we would argue, and we're both from New York and like to make noise, so we would argue loudly. Um, the younger doctors would sometimes look with a little like what so because like they were much more polite, but anyway, because we'd often disagree about what order, and that's something that we learned from experience, because again in the 90s, and I didn't start treating Lyme until like 2001 when Dr. Wayne Anderson joined me, and because I was kind of hesitant to put people on antibiotics based on what we call a clinical diagnosis, because the tests were lousy. They're much better now. Still not perfect, but they're much better now. But the idea that somebody was going to come in and based on symptoms, I was going to put them on 6 months or a year of antibiotics, I thought was crazy. I went to school because I didn't want to well, I didn't want to use antibiotics. You know what I mean? I went to medical school, but my idea afterwards was to treat people naturally. and,
Yeah.
and so I was really like, so I wasn't going to touch Lyme. And Dr. Anderson came and joined me, and he'd been treating Lyme for 10 years already. Because he lived in a Lyme endemic area up in California, and he had worked with Dr. Joseph Burscano. I say these names because to me they're like icons, but I realized that time has passed and Dr. Burscano
Yeah.
doesn't practice much, doesn't practice anymore. He still speaks for IGENX, but he doesn't really, he's not out there. So anyway, but so Dr. Anderson's patients, I start to see some of them, and they look like the patients that I had that didn't make any sense to me, because I was doing a lot of chronic pain work in the 90s, and I'd see these people with these bizarre pain complaints, that didn't fit medical diagnosis. Their MRIs were basically normal. They didn't explain their pain, and I started to see his patients, and they looked like the people I couldn't make any sense out of. And then I realized they had Lyme or Babesia or Bartonella. But the point of the story is, in the 90s, everything was Lyme. Okay.
The trend was Lyme.
And then we started to see Babesia, because what happened, we started to be able to test for it. And so in the early 2000s, the rule was you had to treat Babesia first. That was on top, because Babesia could make people often kind of crazy. I mean, very angry or very depressed, very sad. And it was really a difficult thing. And it often really got worse when you started to treat them. But so anyway, so the rule was Babesia first. And then we started to learn about Bartonella. And it's still Babesia still kind of stayed on top. And I just, over the years, I'm somebody who I remember my failures better than I remember my successes. And I remember the exceptions better. That'd be nice. The failures are only exceptions, of course. But anyway, and I started to see that these rules didn't make sense. You had to look at the patient. It's the same thing with the mold. Generally, it's true. Mycotoxins, you have to deal with the mycotoxins because they're really poisoning the system, as you were saying. So if you don't kind of clean that up, it's very hard to treat anything else. But sometimes you're in situations where you can lower the mycotoxin load, but you really can't deal with it completely. And you can treat the bug. It's just, you have to be, it's not easy because the detox pathways aren't working so well. And if you don't, I guess now one of the concepts that we talk a lot about in the Mycotoxin Summit, at least we have lots of episodes that kind of dance around this. And Dr. Parpia, Nafisa Parpia, who works with me as my partner in these things, her big thing is what she's calling is detox and pre-tox, because really the thing that gets most people sick when they try to treat whatever they have, whether it's mold or these other things, is they have what we used to call quote unquote herxes. Well, a herx is what happens when you kill too many bugs too fast and your body can't deal with it. But most of our patients these days, you kill any bug, okay, and they can't deal with it, okay, because
Mm,
they're toxic. So that's step one. When you say like what order to do things in, is you have to begin to develop the lifestyle that will let you detox. Because if you don't do that, you tend to get those terrible things where I took one binder and I was sick as a dog. My
yeah.
symptoms flared. So
Yeah.
that's where you have to dance with people to detox. And I'm going to shut up for a minute, but I is that so the order in which you treat is, ideally is, prepare the body, detox, obviously get them out of the moldy environment is probably that's part of the pre-tox is get them out of the moldy environment.
Yeah.
But sometimes you might find somebody who the Lyme is dominant. If because we always think that the brain fog is the mold or the mycotoxin, but it doesn't have to be. It's
You're inspiring me to look into more Lyme for myself because I think that could
yeah.
inspire me to look for more Lyme in my clients. I can't prescribe antibiotics, but I
You
could
don't
still
need
be
it.
more Lyme literate. And I 100% agree. I never thought of the term pre-tox. It's very cute. But I say, do the foundations, get the pathways open,
Oh,
think about the pace. I think you've got to kind of think about mast cell because that I think makes you like sensitive to things. So there's a lot of preparation. I don't know if you know, I just wrote a book about mold. I think it's not till chapter 9 that I let you detox. Like,
very wise.
that's a long time. I'm like, here's the everything about your house and your belongings and the foundations and da da da. So yeah, I think we want to detox, and I do often get the question, well, can I detox in this house? I don't know how to leave.
That is the hardest thing that we deal with. I mean, the thing I hate about mold, okay, is is uh is the trauma and the pain of having to
Yeah,
deal with sometimes having to leave your house, or
it's horrible.
yeah,
Yeah,
that is terrible, and it's also so expensive. I mean, I
yeah.
joke and not so jokingly tell people that the two things I hate is to tell you that you gotta spend all your money on getting your house remediated or dealing with your dental issues, because both of
Mm,
them you're going to spend all your money and there's going to be nothing left when you got to pay me. Because I mean, it's true. It's so expensive to deal with these
yeah.
things. But if you don't deal with your home, you're going to be wasting your resources when you're seeing me because we can't fix.
Yeah, that's what I've been saying. I'm like, you can spend all your money on detoxing, but guess what? You're going to have to do all over again when you get out of the home
Yeah.
because it's not going to stick. So I think, I don't know, like a prejudice or a trend in our space is like our clients are learning so much about health and detox. That's fantastic. So they want to like dive in there, go there. But unfortunately, the house is a major, major issue. And for better or worse, like I had to go through all that and spend tens of thousands of dollars. So I at least get it. I at least can say it from a place of like, yeah, I know how much it sucks. Um, and I'm still going to tell you that it's critical.
Yeah.
So,
Yeah. No, in fact,
yeah.
that's why we have at least two, I think maybe three episodes on, evaluating the home and trying to get an idea of what's going on because it's difficult because again, there's no straightforward answer that's going to work because the mold is often hidden. And on top of that, you can have, your family members might be fine. And
Yeah.
at least on the surface, they're not having any symptoms and convincing, a husband or a wife to spend, money that's tight on fixing a problem that they can't see is not easy.
Yeah, it can cause a lot of stress in a lot of different ways. And, like I had a client the other day and she's like, well, we want to build a new home. We have this land, but it's going to take like a year and a half. And I'm like, that's a long time, that's just a
Camping.
that's what we came up with. I was kind of her idea. She said she has a screen and porch, and I was like, okay, I can roll with that. I can roll with that screen and porch.
Oh
The
God.
fresh air, I think, is so healing for our population and the nature exposure. It was for me as
Yeah.
well. So I'd love to pull up your event here and just take a look at, well, we
Oh,
have
yeah.
two things. So let's see. I kind of want to look at this pre-talks book since we talked about it, and then we'll look at your speaker lineup. So there's sort of
Yeah.
two ways to enter your
Yeah.
universe here.
And while you're looking at that, let me throw out one other thing, because just for people to understand is that there are very few specific remedies that mean and this is again something that doctors make this error all the time, and I know that because I've done it, is that thinking because I give somebody an antifungal and they get better, that I treated the fungus. Okay. And it's true, we're treating fungus, but like if you're using the prescription medicines, a lot of the diflucan or sporanox, they also have anti-inflammatory and antibiotic properties that people don't realize. So
Oh, really?
yeah, so nothing is the idea that I did X and I got better means I had Y, sort of.
Oh, really
Yeah,
interesting. Yeah, those didn't do anything for me
yeah.
personally. Almost no pharmaceuticals did anything for
Yeah.
me
Well, that's usually,
except I got like a UTI and strep throat, so those definitely helped me. But
they help.
I'm not against prescriptions at all. Like one thing that's helped me a lot is all my hormone prescriptions. I
Yeah.
wish I had done that sooner because it gave me a lot of quality of life. So yeah, I think it's great to see a physician in your team who can, sort of do more. So this is the pre-tox protocol. You're just calling it out. You're detoxing wrong. It's awesome. So yeah, I totally agree. I like the way you're framing it. So let me go next and show, and I can put this later in the Facebook, the link to this.
Yeah, and it's a shame Dr. Parpia, who wrote the book, isn't here with me today, because this is her baby. Because I said I started off, I did regular medicine for a long time, and I always have to be reminded, because you'll find that there are lots of doctors, because of the experience of being in the emergency room or just being in the office, and people come in really sick and you've got that magic pill and they get better. You get hooked on that, and you're not as ready to do the work
The
of
education and
education
yeah.
and really helping people clean up the body, because doctors work from this thing that, like, here, take this, and the black box of healing, we're going to kill X and then your body's going to heal. And what most of like naturopaths and people who pay more attention to the body are realizing that the body's got to do the healing, and the body needs support to do that.
Yeah, for sure. And that, yeah, you're right. When you're a clinician, it's hard to keep up with. So that's the beauty, I think, of all this online education and podcasts and stuff, because it gives you this rich background. Even for me, when I moved more into functional medicine from Chinese medicine, I was attending summits. I was like so into it back then. I listened to every talk, and I learned a ton. So it's really valuable. So some people I'm excited about here. I'm actually really excited about this COVID long haul.
Oh,
That's a subject I don't know a ton about. I think that's really interesting. This Isaac Elias, is that how you say his name?
yep, yep, yeah.
I've heard some really good things about him, and I don't know much about him. Paul
Well,
Anderson, I think you mentioned, and I've heard of.
no, that was I was his Wayne Anderson
Oh,
is
gotcha.
yeah, no,
Okay.
Wayne, but let me just give a little time, because you picked just people I love right off the bat. So good picking. I love them all. But so Dr. Mobeen Saeed he's a guy who I fell into when COVID started. He's a teacher. He teaches doctors and medical students, online, like little, hour courses on different subjects. And he has just been so clean in his podcast about the world of COVID, not nutsy either direction, just the data, going over things. And he really is so thoughtful. So he's a pleasure to listen to for just
Oh, awesome. I'm going to
nice
follow him.
information. And he's got a
Okay.
great, he's got a great podcast. It's Dr. Bean.
Oh,
And of course, Jill Carnahan is wonderful. And Isaac
yes.
Elias, Dr. Parpia worked with Dr. Elias about 5 years ago. He's up in Santa Rosa, just north of us. And I've known Isaac for about 20 years. And his specialty used to be more oncology, but he over the years has done a lot of work with Lyme and then with mycotoxins. And he's just a researcher as well as a physician who's done a lot of good work. And he fell in love with it. Can't tell you the story now because it'll be the whole thing about with binding initially a chemical your body makes called galectin-3, but also what he developed was the pectosol, the pectin lining inside of citrus fruits binds lots of toxins.
Oh, cool.
And
Yeah,
he's
I didn't know
developed, he has developed and funded lots of research with this in cancer work that's been published. It's quite impressive. And it also works for binding a lot of the mycotoxins and a lot of the toxins in the environment. So he's got some interesting ideas. And Dr. Paul Anderson is like one of the pillars of naturopathy in the last 20 years. Paul teaches, he teaches many things, but one of the things he was famous for is teaching a lot of the IV therapies for naturopaths. But Paul is, again, a real original thinker, somebody who thinks from the bottom up,
And a lot of people have this question, does my mold or chronic illness affect COVID for me? So it looks like he's covering that.
Absolutely,
and and I'm just Jill is amazing. I'm just pointing out people I don't know as well because some of these people you may have seen on my summit.
No.
Michael, I've heard of a bit. I know he teaches some courses that frankly were way over my head.
Oh yeah, Michael is he does deep dives into chemistry and a lot of interest in this Dr. Ravici that hardly anybody knows about, and he's a brilliant man and insights that you wouldn't think of.
Awesome. Yeah, peptides I don't know a bunch about, so that's a good one.
And Dr. Crozier is a really great teacher. I mean, what we love about Gordon is that clarity,
That's so great. Yeah, that's what people want.
Very clear.
Okay, I'm going to move on a little bit here. Oh, well, this is cool. The TH1 and TH2 shift. I feel like that's one I could use a little more clarity on.
Yeah.
So
And Dr. Schallenberger is one of the people who really have popularized and introduced ozone. The people have been doing IV ozone in America since the 80s, but Dr. Schallenberger really took the time and energy to create a teaching format for doctors and has really brought it forward quite a bit.
Okay. And Jill, I know she has been diving more into the pans and pandas, so it's great for if you've got kids involved here. Super interesting. Lauren, I know a bit, but yeah, I've never really heard her speak, so that one's cool.
She's great for, again, these are people who are able to get a message across with clarity. I love to go people have to put up with me going all over the place, and these guys can come back and give you the ABC, so you really come away feeling like you've learned something.
Yeah, I'm more circular too. I've had to kind of learn to be less. So Lynn, I know a bit from what is that? What's that conference she gets?
The ICI or the EHS, the Environmental Health Society, whatever it is. Yeah. And again, Lynn is like Paul Anderson, one of the pillars of,
Long
of,
time.
of bringing naturopathy, forward in the world, and
Awesome.
especially in the environmental, anything about chemicals. Lynn is the person who knows it.
Well, I'll point out a good friend of mine, which is Peter Kahn. We're going to Sedona for Easter together, so
Oh,
we're good
wonderful.
buddies. So okay, something he's here on a tick-borne illness. That's awesome. The T
Yeah.
cell, super awesome.
Well,
This
yeah,
is very
this is,
technical.
yeah, well, no, what it is Dr. Schultz is going to, it talks about, he runs a lab that does a wonderful Lyme test that is a little more specific for Lyme activity than the general Western blots, okay, or immunoblots are these days. So it's much better. And Dr. Harris is a great Lyme doc, and we just kind of go into like how to think about it. And there's a treat there. Dr. Pimental is the Mr. SIBO guy.
Oh, gotcha. Yeah, lots of people with digestive
Yep, yep.
issues. Beth, I know. Kashif, I know. I don't know Joe Smith here.
He's a neurologic chiropractor, and it's amazing how many people have, balance issues, have cognitive issues that, we treat what we think we're finished with them, and they're still not quite right. And it's because the brain, from all the inflammation and maybe an old minor head injury, there's a pattern in the brain that needs to be retrained. So we gotten rid of the inflammation, like the big outside inflammation, but the brain is still caught in a loop. And these
Yeah.
neurologic chiropractors, and Joe will talk a little bit about the process of, they can help get you out of that. And it's quite
Yeah.
amazing. A lot of our patients who we felt like, oh my God, what next? And Joe helps. So
Yeah, I need to listen to that one. I listen to a lot of Datis Karazian but
exactly. Yeah.
yeah, but this is seem a little bit more specific to mold. I mean, I think that's, yeah, something I experience, something a lot of people experience in those later stages. So, um, Kevin Connors, I know. Matt, I know. I do not know Heather or Michael. Oh,
Let's see. Well,
remediation.
Michael Schranz is, again, a man who people can count on, because Michael you can consult with for not a lot of money, and he is about what to do for your house. Okay, because
Great.
Michael,
Great.
he is involved with almost all what they call the environmental engineers, and they're just he's can be really helpful when you're stuck.
Okay. Awesome. Tom is so fun. That's
Yep.
awesome. Let's see. Does anyone you want to highlight
No,
here? These
those are
ladies.
people, there's funny because half of them, I didn't interview everybody. So some of them I don't know that well. I'm waiting to listen myself.
Oh, okay. So some of
Yeah.
these your
Because,
partner interviewed or
either
something.
Dr. Parpia interviewed them, or some of them Dr. Schaffner interviewed, because Christine is co-producing this with us. So
Oh, I did notice that. Yeah,
yeah,
Christine is
there's some
really close
that
to
she's
me.
doing.
Yeah, Ryoshi I know, Mary I know. Kelly, gosh, I feel like I just heard of her. Maybe because of the mast cell, which I'm
Yeah.
fascinated with.
Yeah. Kelly also, worked a lot with Dr. Nathan along the years. So, she's very good,
Okay.
very good. Yeah.
Okay. Exposome. I don't know anything about
Yeah. Well,
that.
just basically all the other it's sort of like, we have Lynn Patrick and I'm trying to think of it, but especially, and Dr. Sue putting together the other environmental toxins that are out there that can be affecting you.
Okay. Yeah. So important. I included that in my
That you
event
need to
too.
deal with. Yeah.
Yeah, you need to deal with Dan Pampa is a big name in this space. I know he's got a raging following, which is
Yeah.
great.
Yeah.
Mycotoxins in coffee, that one might be interesting.
Oh
That's a
no,
lot
no.
of debate.
This is a very interesting man. A story of the coffee he's produced. That's, not just no mycotoxins in it, but also grown to increase the polyphenols and the things in coffee that are actually good for you.
Oh, is
You
this the
know.
purity coffee?
Yep. Yep.
Okay, yeah,
And
I've
I
heard
have
of
to
that.
say, it really is amazing.
Okay, I'm gonna have to try it. I actually became a little bit of a coffee drinker during COVID.
Yeah, well, no, the story about coffee is I've been following, I said, I've been doing this a long time, and there's nothing more useless in medicine than what we call epidemiologic data about behaviors, like basically about when you try to figure out from looking at like huge populations about what's the best, is X safe to do? There are very few things that have clear enough endpoints that you can do it with, smoking, drinking, alcohol, but even that gets muddy because things muddy it. But when it comes to things like coffee, the data is useless, because at the end of the day, they don't look at the populations very clearly. And then when they do look, coffee comes out way ahead. It's actually a health drink, but, but not if you have a nervous system that it makes you vibrate.
Right. Yeah. Coffee sometimes I cannot do, or even tea or chocolate.
Right. Well, because you're not breaking down your xanthines and things very quickly. But anyway,
Yeah.
but
Chris
for other
Shade,
people,
it's
fine.
awesome you got
Yeah.
him. I don't think he speaks a lot. Good job.
This
He's
is
really
fun.
cool.
The only thing I
Yeah.
have to, a warning here, we
Yeah.
should have a parental guidance warning on Chris's interview.
Ah.
I interviewed Chris in like Two Old Hippies. We sometimes the language got a little, but so don't have your 10-year-olds listening.
Don't listen in the minivan. Okay.
Right.
Nick, I know about. Karan is a good friend of mine,
Ah,
always a great speaker.
yes, amazing.
Yeah. Todd, great with the parasites.
Right.
Awesome. Is this Dr. Jess right here?
I believe so.
I've never
I
seen her.
don't think I did not interview Jessica. So
Okay.
yeah.
Tom, I know a little bit. Super nice guy.
Yeah. And
Siobhan, I know.
And Andriana was someone who worked for many, about, I don't know, probably, God knows. She was Dr. Klinghart's chief trainer for about 10, 12 years. And
Oh, cool.
she,
Okay.
she knows a lot. And Dr.
Okay.
Moorcroft is an inspirational talk there, just really good human being. And a little
Okay.
bit about
Yeah.
Lyme.
Yeah, he knows a lot about Lyme. Oh, cool. You got one on Healing the Land with Joe Salatin. That's awesome.
Yeah.
Um,
Yeah, and that's yeah, because that's just so important.
you got Dave Asprey. I couldn't get Dave Asprey. Good
Uh,
job. I have interviewed him once, but he's hard to get sometimes.
yeah. No,
And I love this topic, living and thriving in remission. I kind of ended with some of that too, because it is like part of the story, like recovering your brain and your mood, and like accepting that you can do things again, and like not only do things but like make your life even better. It's not something you think about when you're in the throes of it, but you actually can get there, and it's important to cultivate that, in my opinion, just as much as all the other things.
Yeah, no, and especially because sometimes you have to sometimes, unfortunately, you have to deal with, there are certain parts of your system that doesn't come back 100%,
It's
and
true.
how to bounce with that, or just know that, you might get a symptom flare and how to deal with it.
Yeah, I just got invited to go to Florida, and I was just there, and I'm like, if I'm going back to Florida, like there's got to be a lot of not the climate, but just the traveling and the time change.
Yeah.
That one is one thing that's hard on me. So I just have to be cognizant of that. And I'm supposed to go to Peru, and I'm like, that's like an all day flight. I'm like, I
Yeah.
gotta maybe think about that one. So lots of gifts here. Is this if you purchase, or no,
Yeah.
just if you sign up, huh?
Yeah.
That's amazing. Well, you did an amazing job with this lineup. I'm super excited. I'm gonna sign up once I get off of this call. I almost want to feel like this is like a partner event to the event I did, because there's a lot of new stuff. It's very technical, which my audience loves. So I really encourage people to sign up. Again, don't feel overwhelmed. You don't have to attend every talk. Just tune
That
into
would be a
what you want to.
marathon, yes. But once
Yeah.
you sign up, if you get it, you really have a chance, because number one, a lot of these, I mean, I've listened to them more than once on some of them that I've interviewed, because people, they're giving you their deep insights, and when you're in this, your memory's not great, so it's nice to be able to listen again. And even if your memory's great, get a little older, it's nice to listen again, and
Yeah.
just get the idea that if you're not getting better with what you're doing, there might be another way. I mean, there's so many ways back to health. I think that's what I but I know we're probably running out of time, but just
No,
the
good.
final, my most important point is that chronic illness, okay, is not about what got you sick. It's about how your body is dancing and responding to the stress and the original insult and all the other stuff that makes you you.
Wow, that's a
Okay?
great
And,
insight.
right.
Yeah.
And so that's where, regular medicine falls down, because regular medicine, our drugs are going to work for 80-90% of the people. For that, if you hit the right target, it's like using a hammer. It's perfect. It's going to get that nail. But if it's a lot of different things, the hammer's not very good. So anyway, but my main point is that it's your system. So what worked for your friend may or may not work for you, you know, and
Yes.
you have to keep it. Don't give up. I think that's my main point. Is that I know it's overwhelming, and many times, again, I get back to the money thing, because it's terrible. You'll spend so much money trying to get well if you're not lucky and hit it quick, but it's your life. Don't give up. And
Yeah.
what the reason we have so many people, and the reason we've done mycotoxin 2, and we'll do maybe another one, maybe not mycotoxin, a chronic illness, is because there are so many different doorways that need to be explored until you find the one that resonates with your cells in your body and gives you the nourishment and the information, because it's all about information internally, to let the system begin to go back to normal. And the beauty about the body is we don't have to be perfect. We are self-healing. Many times we just have to either remove the block or give a little more oomph to something that needs support. And
Yes.
so just
I
don't give up hope.
100% agree. Yeah, I agree with all of it. I mean, besides the pre-tox, the rest is quite organic and flexible, in my opinion. And I don't think there's a super strict order. Do you go after the gut or Lyme or this or that? Like, it's sort of like, what can you handle? Some people can barely take a drop of a tincture. So we're not going to do the same thing for that person as another person. And some people get frustrated. They try something and it doesn't work. Like, just let that be part of the organic process. And I would encourage you not to put all your money into one bucket. Because you don't know that bucket is going to be one that's for you. So and yeah, the don't give up hope. I totally agree. We don't do this. Eric hasn't been in this field for 40 years to make money. He has a passion for it, right? And he's a problem solver and a puzzle
Right.
solver. And in my own journey with mold, I think because I really believed in that I can be healthy and that there's so much out there, I just kept looking and exploring little by little. And again, that can be organic. That doesn't have to be, never be up on Google till 2 a.m. That's not healthy. So just explore, and the universe will give you little gifts. Like, this summit is a huge gift. And if you take away a couple things, like you get a new test or you try a new thing, or like you just get some peace of mind, fantastic. So I really thank you for putting this together. I wish you all the luck. If you're watching, please sign up. Yeah, it's like an A+ lineup, honestly. Like, I'm super impressed.
Well, thank you. And that's it. We just want people to have possibilities, because we see people, they've shopped, they've tried for 20 years sometimes to get well. And
Yeah.
and I'm amazed by the spirit they have, because to be honest, I don't know if I would keep going, but there are people who just are strong. And don't give up. And most importantly, if something makes you feel really worse, it doesn't mean it was bad for you. It just means that it was the wrong amount at the wrong time. Okay. Because
Yeah.
most of the things that people are using to treat these illnesses with, if you're healthy, you can take them like nothing. Okay. And so if something
Mm,
disturbs your system, you're exposing a weakness that maybe we need to support differently,
it's
but don't run
information.
away. I mean, that is the most common, and I think shoot yourself in the foot approach is, I did X and it made me sick and that was terrible and I'm never going to do that again. And no, it was just, yes, it was too much in the wrong amount or the wrong timing, but there's information there. Doesn't mean you have to do that again.
That
But
is a great point. Yeah. Yeah. We get very emotional about side effects. And I made a side effects guide you can find at my site because when I categorize them, like, there's not that many side effects, actually. There's like gut or headache or whatever. And like, there's ways to deal with them. So if you kind of look at it from that view, yeah, there's things you
just
can
go
do.
slow. Listen to your own body. If the doctor tells you to take, 20 drops and you're not, start with one. I mean, it's like, don't, there are, if you're being treated for, meningitis or pneumonia, you're going to die. Well, then, take the dose they're giving you because you're going to die. But when we're treating a disease that's not killing you, at least not fast. So actually the good part is these diseases rarely kill people. Rarely. They make you feel miserable. You kind of may wish, but they're not fatal. But because they're a dysregulation in your own immune system. They're rarely just the effect of the toxin. Okay.
That's a great point. Yeah, that's a really interesting point to think of. Well, I'm going to sign up. I'm going to purchase it, to be honest.
Come join us for this exploration because that's what we do. We're having a chance to learn and expand everybody's horizons. I learn a lot doing these. I mean, the reason we're doing mycotoxin, because I was not fully on board with mycotoxin one. Oh my God, this is a lot of work. But once I started doing it, I was talking to people and learning stuff that I didn't know. And it's like, and I've been doing this a long time and I don't know some of this stuff. If you're just gotten sick, believe me, you got a lot to learn about. And you might find that, wait a minute, I thought I had X, but that sounds more like me. Maybe I should at least look.
Yeah. To be honest, I think mycotoxins the most fascinating thing. And I know a lot about it. I'm going to get a quick plug for our book club in a minute. Like, I know a lot. And now I'm reading this and I'm like, man, there's still a lot more stuff. Like the Th1, Th2, it's like I kind of know it, but it's not like sunk in for me. So I'm going to purchase it. If you want to be in more community as you heal for the next little bit, you can still join our book club. It just costs the price of the book on Amazon. Any form you buy the book in is fine. And then I'll put this link in here. And then you can, be in community, even if, stuff you learn on the Mycotoxin Summit, bring your questions to the group, bring like what you're trying to the group. It's just one more way to, be together here as we heal. So let me put that in there and then we'll wrap up and I'll get the links, all these links up on YouTube and the Facebook groups. I know I didn't have them up right away.
And it sounds like your book, and the fact that you said it, if it takes to chapter 9 till you get to treatment, that is a good foundation because that's really what people need. So I'm excited.
Yeah, I was almost a little sad I couldn't get a little deeper like into the protocols, which is really my specialty, but I wanted it to be kind of the start to finish. And frankly, that includes the house and, the self-care and all that. So we did it that way. So maybe someday, I don't really want to do it right now. I'll do a part 2 more about body systems and protocol, or maybe that's for you to write, Eric.
Someone, I'll dictate it. The reason I went to medical school was it was multiple choice. I didn't have to write a paper.
Yeah, I'm not exactly like a supernatural writer. I'm like 50%.
But it sounds like a great. I mean, that this is what people need is that is just how to take care of themselves, because again, this body does amazing work. The secret of medicine is that doctors don't do much for you. Again, when you're dead and dying, when you're after a car accident, we're really great. But for you wake up in the morning with a stomach ache or a sore back or this or that, most of the time you get better within a week or 6 weeks, and doesn't matter what the doctor did. I mean, that's why it's so cool to be a doctor. When you're a mechanic, you got to really fix it right. The medicine, you got to get close, and the body heals. So just doing the foundation work of cleaning up your environment is going to give you a good first step. I know when that doesn't work, then you get to spend your time talking to people like me. But hopefully the simple stuff, listen, they're not simple. The harder stuff to do, which
It's
is
not easy to change your
no, no,
lifestyle,
exactly.
change your
Right.
mindset.
Yeah.
Yeah.
It's much easier
Yeah.
to come to me and get an IV or get a supplement or a drug. That changing your life is hard work, but that's really the work.
Yeah, I can tell you're a lot like me. We're like a little more like there's lots of options and there's creativity in it. I know some people don't want to hear that. They want to hear like the linear path. But like let it be a relief to you that actually there's a lot of options and ways to heal. I
Yeah.
think that's fantastic news. So,
Yeah.
this event will give you even more options. And again, I thank you for being on, taking your time to be on with me. You don't even give a talk in your thing. That's crazy.
Well, I give lots of see because during the interviews, I'm
Commenting a bit.
there's about probably out of a 50-minute interview, we try to keep only about 10 to 15, 10 minutes of me. I try to keep because I love to talk, but I try to keep it minimal because you're coming there to hear these people because they have the information. I'll just throw in hopefully a, a little bit of me, but really that's important is find the doctor that's right for you too because
True.
you have to live with them, and so it's a relationship, so make sure that you feel comfortable, you know.
Yeah, that's another I feel kind of calling is like again, kind of like that organic follow your heart. Sometimes you try something and it doesn't work for you, but if you listen to a certain practitioner on the event and you're like, "Oh my gosh, that's the one I want to follow next." Go do it. So yeah, there's a lot of options in that category too. You opened my eyes that there are more than I realized. So it's very exciting what's going on with this field. I hope we can continue to collaborate and get to know each other.
Yes, look forward to it. I really do. It'll be fun. Got to get your book.
Yeah, please do. And thanks for
I'll sign
everyone for
up.
watching. We really appreciate it. And I'm actually have a lot more people coming up. I've got a mold attorney I'm gonna have on, and a couple remediators and inspectors. I'm working on a mold realtor. Did you even know that
Oh,
existed?
wow.
So we've got some fun people coming up in the book club. So stay tuned. Thanks, everybody. Appreciate
Thank
it.
you. Pleasure. Bye bye.